Ladies and gentlemen, health-conscious viewers, and those seeking to safeguard their well-being, welcome. Today we are diving into a topic of utmost importance, a topic that could potentially save lives. Buckle up, because we're about to embark on an enlightening journey to uncover these 12 warning signs that will present themselves when your kidneys are in jeopardy. Those who are currently afflicted with liver disease, those who have previously suffered from a liver sickness, or those who are familiar with someone who has a liver disease should be aware that it is a form of unnoticed mortality. Because the majority of patients do not notice any symptoms until the disease has progressed to a very late level, it is far more deadly than it already is. Although the level of education required to recognize renal illnesses' signs and symptoms is not particularly high, a very small percentage of the general public ignores them. Regrettably, in other instances, the manifestation of symptoms might not take place until the disease has already reached a severe degree. As a consequence of this, it is essential to both be aware of and be able to recognize the warning signs. Before we get started, I would like to extend an invitation to you to subscribe to our channel and turn on notifications so that you are always kept up to date whenever a new video is uploaded. Now that we have that out of the way, let's have a look at the top 12 warning indications that you may be suffering from a kidney ailment.
This is Metamorphic Fix.
Here are the 12 warning signs that will present themselves when your kidneys are in jeopardy. Number 1. Alterations in urination quantity and frequency. The first sign that a person has kidney disease is when there is an alteration in the amount of urine that they produce and the number of times that they urinate. There is a possibility that the amount of urine that you pass could significantly increase, while there is also a possibility that it will decrease. It's also possible that the color of your urine will change at various times throughout the day. You may have an overwhelming urge to urinate, but when you get to the bathroom, you'll find that you can't urinate at all. If you notice a change in the way your urine is functioning, pay attention to it and start keeping track of the number of times you use the restroom every day. This is especially the case when the shift at hand is significant. Number 2. Difficulties or discomfort when urinating. You may have difficulties, pressure, or discomfort while attempting to empty your bladder. This can be a sign that your bladder is full. You may have an infection of the urinary tract if you are experiencing this symptom. A urinary tract infection, UTI, occurs when a group of bacteria gathers and multiply within the urinary tract. It is easy to treat, but it is essential to find out about it as soon as possible because it has the potential to spread to your kidneys, which will result in a fever and a painful neck. If you catch it early, however, there is a simple treatment for it, which is a course of antibiotics prescribed by a doctor. Number 3. Blood in the urine. This is one of the most evident indications, and it should be treated carefully, as it should be taken very seriously. Additionally, it is one of the indicators that suggests there is an immediate requirement for medical care. As a result of this, you should not disregard it if you ever come across it. Blood in the urine is an obvious indication that the kidneys are not functioning properly. In the event that you see this symptom, it is imperative that you contact your primary care physician as soon as you can. There are multiple types of bladder cancer, and there's a good likelihood that blood in the urine is associated with all of them. Number 4. Cloudy urine. I know what you're probably thinking, which is that a lot of these so-called symptoms are only related to the bladder. I'll tell you what, you're wrong. However, due to the close link that exists between the kidneys and the bladder is the first organ to be affected if the kidneys become dysfunctional. If this is the case, you will notice that your urine has a cloudy appearance. Cloudy urine refers to urine that appears hazy or murky, rather than clear and transparent. This change in urine's appearance can be caused by various factors such as the presence of substances like mucus, pus, or proteins in the urine. Cloudy urine might indicate an underlying issue, such as a urinary tract infection, kidney stones, or other medical conditions. If you notice persistent cloudy urine or have any concerns, it's advisable to consult a healthcare provider for proper evaluation and guidance. Number 5. Swelling, also known as edema. It is the job of your kidneys to eliminate any excess waste and fluids that have accumulated in your body. If they are unable to do so, the body will start to accumulate an unusually large amount of waste and fluid when they are unable to do so. When this occurs, the person will become aware that their hands have gotten exceedingly tense, that their face is puffed out, and that their feet and ankles have swelled. Number 6. An extreme lack of energy. The production of the hormone known as erythropoietin is dependent on the health and function of your kidneys. This hormone is helpful to red blood cells in their mission to deliver oxygen to all parts of the body. Your levels of this hormone will drop significantly if your kidneys are not functioning as they should. Your body will become unable to keep up with the demands placed on it as a result of the sudden fall in the number of red blood cells. Number 7. Dizziness and an inability to concentrate. When your kidneys are the cause of your fatigue, your brain suffers from a lack of oxygen because of the kidney's inability to filter blood properly. Because of this, it may be challenging to focus one's attention. It is possible that this could cause you to feel lightheaded and interfere with your ability to concentrate. When the brain is deprived of oxygen, it begins to work more slowly. Number 8. Feeling cold constantly. If you have anemia, which can be brought on by kidney disease, you may feel cold all the time, even when you are in a warm environment. This is because anemia prevents your body from producing enough red blood cells. In addition to chills, fever is a symptom that has been linked to pyelonephritis, which is an illness that affects the kidneys. Number 9. Skin rashes and itching. Itching and rashes on the skin are symptoms that are commonly misdiagnosed as being caused by other disorders, such as allergies. On the other hand, signs of renal illness and failure may include itching and rashes on the skin. The failure of the kidneys, which leads to an increase in the concentration of waste products in the blood, this is the underlying cause of the extreme itching and rashes that have appeared on the skin. Number 10. Ammonia breath and metallic taste. One of the signs of renal disease is an elevated level of urea in the blood, which is also detectable by the presence of ammonia in the breath and a metallic taste in your mouth. Ammonia breath is a sort of foul breath that smells like urine. The breakdown of urea in the saliva into ammonia is what causes this kind of bad breath. Number 11. Nausea and vomiting. If your kidneys are failing, you will constantly feel uneasy and sick to your stomach. You may also experience diarrhea. This will not be a solitary incident in any way. Because of the accumulation of waste materials in the body, their clearance is required. This is the reason why vomiting occurs in this state. Number 12. Difficulties in breathing. If the kidney disease has developed to a stage where it is severe enough, it may create an accumulation of fluid in the lungs, which may give you the sensation of being unable to catch your breath. This occurs when the kidneys are unable to filter waste products properly. If this is the case, then you may be suffering from anemia or another kidney condition that will prevent your body from receiving the oxygen it needs. It is essential to keep in mind that the presence of any one of these symptoms does not necessarily indicate that a person has kidney impairment, even if the individual does in fact have the impairment. In spite of the fact that many of these symptoms are also signs of other diseases and infections, it is essential to investigate their causes and discuss them with your doctor if you are experiencing them. If you are having any of these symptoms, consult your doctor. They have the capability of preserving both your kidneys and your life at the same time. Have you been enjoying yourself while watching this video? Click the like button and then go subscribe to our channel so you can watch more videos just like this. Be sure to leave your thoughts down below in the comment section. We are grateful for the interest you have shown. Thanks for watching.